Good morning and welcome to COVID-19 Talk with local health authorities. With me is Dr. Sherri, Onyiego, representing Harris County, Dr. David Persse, representing the city of Houston. This is sponsored by the Rotary Club of Houston. Thank you to past President Kathy Finninger. I'm Stephen Williams, Director of the Houston Health Department. Wow, it's still going on, eh? Yeah. Vaccines, when will teachers be on the list? In other states, they are 1B. What about grocery store workers?
Well, that's been said. In Texas, that was the 1B categorization was set by the state, and they chose not to go with occupations, but rather health risks. And so for those teachers that meet the 1B criteria over the age of 65 or over the age of 18 with certain illnesses, then they can get vaccinated. But by occupation, that the state just specifically and thoughtfully decided to go in a different direction.
When do you project a move to phase 2 for vaccines?
Well, again, I think that's a state sort of decision. There's the expert vaccine advisory panel, and then there's the sort of the reporting and sort of the decisions that are made at that level. But I think we still have a great amount of people to get through with the 1A and 1B category collectively before we move on to the additional populations. But
yes, 1B is actually, I thought it was 8 million people, but it's actually 11 million people.
Okay.
So it's going to take a while.
It's going to take a while.
It's
about a third of the population, isn't it?
Yeah.
Give or take?
And even for the county, I think it's closer to almost well over 1 million, 1.5, 1.6 million.
Oh, wow. Have you considered permitting family groups to be vaccinated, for example, those living in a household with a frontline health worker?
Well, I think if we had ample vaccine, we could do things like that. But right now, they're trying to be a little bit more strategic and get into those folks who are most at risk of having the most severe consequences should they become infected.
Oh, Stephen, you have said that we will be contacted 48 hours prior to when we should receive our second dose. Who do we contact if we hear nothing? When is an online self-scheduling option going to be available? Actually, those people who are scheduled for their second dose will be sent a link so that they can actually schedule their own appointment. It was actually misstated in the paper. They said we were going to open up a website, but that's not true. What we're going to do is actually send the link to the specific person. And now I'm going to put myself on the spot. If you haven't received the link within 48 hours of your second dose, and you got that from the Houston Health Department, you can actually email me at stephen.williams@houstontx.gov.
That is a gutsy move right there.
It's a gutsy move because my people better send that link out. They better send the link out. The other thing is I know that my office is getting calls about that, and so we're troubleshooting them anyhow. So it's not much of a risk. If there are 70,000 on the wait list, you are not adding more names at this time. What's next? Actually, what we have been doing is working that waiting list because we think that it's fair to do that. But there is a level of screening that is going on. I mean, if you're 25-year-old, have no chronic conditions, then you're not likely to be scheduled through our system. But we're also working through federally qualified health centers and other community clinics to ensure that certain individuals within high priority zip codes have access to that. So we have at least 2 parallel processes that are going on. When are vaccines being given this weekend, and can we still sign up?
So we have, again, like I think we talked about on the previous shows, we have a process now where individuals can register through what we call our SMART vaccine wait list, or they can call our vaccine call center. And so based on the screening process that they go through to register for that, they'll be randomly selected with priority given to those with a certain age, older age group, as well as healthcare workers. And so once that process happens, they get randomly selected but prioritized based on age, then they will be able to get, they'll get a notification to get directed to a site to get vaccinated. So we're doing weekly vaccinations based on the allocations of vaccines that we receive from the state. And so as our vaccine supply remains, then that's when we go through our randomly selected individuals on the wait list to notify them.
Yes, for us, a lot of our weekend activity, at least for this weekend, is going to be the administration of second doses. You remember about a month ago, we did 3,800 folks at Minute Maid, and so we're actually splitting that up between Friday and Saturday. Some at Minute Maid, and some will be at Del Mar for that second shot. Yeah. We want to make sure that people are completely vaccinated.
Can I have one thing, we talked about this morning, one thing about that second dose, to warn folks or to ask folks, is if you get, wherever you get your first dose, make sure that you go to get your second dose from the same provider. It may not necessarily be the same physical location, but from the same provider agency. And the reason is, if you get your first dose from provider A, and then you decide to get your second dose from provider B, what's going to happen is that provider A is going to have a second dose for you, and they're going to be reaching out to you and reaching out to you and reaching out to you. Provider B, they're going to assume that was your first dose. They're then going to get a second dose, and they're going to be reaching out to you and reaching out to you. And if you don't tell them that you got your second dose, at some point they're going to be afraid that they're going to waste that. So they're either going to give it back to the state, or they're going to give it to somebody as their first dose, for which then there is not a second dose scheduled to come. So by getting your second dose from somebody other than your first dose really screws things up. So please don't do that.
I've had COVID. When I receive a vaccine, will the side effects be worse?
Yeah, I mean, I think we've also talked about this a little bit before. I think that when individuals get the vaccine, there's what we call reactogenic. And so it's really the immune response that's mounting in individuals. So individuals can expect to have some potential effects of a vaccine that's administered to them, like fever, sore arm at the injection site. Some people may have fatigue, but again, that's the immune system that's mounting itself. Individuals who've previously had COVID, we're still, really recommending that those individuals still get the vaccine regardless. But in terms of just because they had COVID, will they have more symptoms? That's going to be difficult to say someone will or won't. But we're still encouraging folks who've had COVID to still get vaccinated.
So please elaborate a little bit on what people are experiencing maybe after their second dose.
Yeah, and so like I was just saying, like a number of the common things that the immune system will do in response to it, because especially at second dose, that first dose is almost like a primer, and the second dose is almost like what we call a booster. And so individuals can potentially have fever, sore aches, just feeling just a general sense of fatigue. But again, that's your immune system that's responding to that vaccine. Okay,
thank you. Thank you for joining us with COVID-19 Talk with local health authorities. We'll be right back.
Houston, we have a problem, more like a pandemic, and now it's all of our responsibility to make sure we end it. So this is a declaration for us. 3rd Ward to 5th Ward, we can't afford to lose this. It doesn't matter which state open first. We cannot allow this virus to get worse. Memorial, Main Street, A-Leaf, Acres, Home, Sugarland, and Sunnyside. Trust, we know it's hard to stay inside of your home, but you are not alone. And when you do leave, mask up. If not for you, then for other Houstonians. River Oaks, West U Heights, Higham Park, Galleria to Greens Point. May we point out to you that keeping your distance is still the safe thing to do. Remember, there are people on the front lines. Show them we still have their best interest in mind. East End, 2nd Ward, Midtown, and MLK. And if we didn't name you, the same is true. We all have a job to do. Please wash your hands and get tested. It's time we invest in this great city, because where others may not have a solution, this is Houston. And we must protect the H.
I hear someone go, "Didn't it come from you guys?"
Strangers cough at me.
Move away from me.
Someone spit towards my direction. All the stereotypes that we've worked so hard to break are just gonna be reversed. And I won't let that happen.
We all have to play our part.
I donate my plasma.
I've been making masks.
We deserve respect as much as everybody else.
I'm a firefighter, not a virus.
I'm a mask maker, not a virus.
I'm a nurse.
I'm a delivery woman, chef, a neighbor, artist,
Bus driver.
I'm a doctor.
Fight the virus. Fight the virus.
Todos tenemos nuestras pequeñas rutinas. Cosas que hacemos casi sin pensar y que no podemos olvidar. Que repetimos una y otra vez por nuestra seguridad y por la de nuestra familia. Ahora tuvimos que añadir algunas más para proteger a todos. Cada día cuenta. No te olvides. Ponte la máscara, distánciate, lávate las manos, hazte la prueba. Hazlo siempre. Haz que cuente.
Wash your hands. Avoid sick people and touching your face. There are everyday actions to help prevent the spread of respiratory diseases. Visit cdc.gov/COVID-19. Brought to you by the National Association of Broadcasters and this station.
Welcome back to COVID-19 Talk with Local Health Authorities, sponsored by the Rotary Club of Houston. Please explain what is in the multiple doses. First shot is fine, second shot, is that exactly the same formula as the first dose? If a booster shot 3, if needed for the variant, will that formula change? Can you take a booster of a different vaccine?
A couple of things to unpack with that one. So the current vaccines that we have authorized right now are Moderna and Pfizer. The actual chemical content of each vaccine dose, first or second, is the same for the Moderna brand, for the Pfizer brand. So there's no difference in terms of the actual contents with Moderna, first dose, second dose, or with Pfizer, first dose, second dose. There are studies now that both of those companies are taking underway to look at what a potential booster or third dose down the line would look like to have additional activity and protection against the circulating variants that we're seeing across the globe. So that potentially could look a little bit different. But again, I think the fascinating thing that we have to sort of realize with this type of mRNA technology is that we haven't, that we're able to do that, unlike we've been able to do before. So that's certainly some advances that we're making with the innovation and the science.
Yeah. I have a comment. I'm going to read it. I don't know there's a response. My 26-year-old niece, perfectly healthy, was vaccinated. I won't name the place. Places prioritizing their customers whether you know it or not. I mean, basically, this comment is saying that individual institutions are prioritizing people that they have contact with.
That may be true.
Yeah.
Yep. Select pharmacies will begin receiving vaccines next week. Is there any easy way to find out which ones in our location will be participating, as even those on the list might not be? Yeah, we were talking about this earlier before we started.
Yeah.
We're not really sure.
Yeah, sure.
Really, all we know is that the feds have said that they will be sending vaccines to a certain number of pharmacies. I'm not so sure that we know exactly how many of those pharmacies will be in Texas, and we're not really certain of what the criteria they're going to be using.
That's a federal program, right?
Yeah, it is a federal program. We found out earlier this week that the feds were going to pivot to this. One thing that one of the White House COVID advisors said is that they're not going to put a whole lot of vaccine out into that system, but what they're doing is trying to test the system to see how they will be able to handle it once vaccine is plentiful. So it's really like kind of priming the pump to make sure that we have put a system in place for...
I'm wondering if that isn't if they aren't thinking about that, because for those clinics, remember the second dose is the real challenge, right?
Yes.
So whoever you give the first dose, so you have to have a way to reach out and give them the second dose. But that system would probably be great for a one-dose Johnson & Johnson, a one-dose vaccine. Yeah.
We'll see which way it goes. Well, Johnson & Johnson's not out yet, so we know that if they get it next week, it's going to be the Pfizer or Moderna. So.
Yeah.
Although Texas received the second highest number of vaccine doses, it is 49th per capita. Is the calculation of what we receive based on total population, or only those eligible at the time? I'm not really sure about that. I would say we're looking at the population, and there's been a lot of discussion of whether or not we're receiving our proportionate share. I know in discussions between the state and the feds that are, from a state perspective, we're not exactly clear on that yet, and there has been advocacy for us to get more doses as a state. Who should recently retired medical personnel contact to get involved with helping with vaccines, city or county? The answer would be both.
Yeah.
Both. Yeah.
So
Absolutely.
the Medical Reserve Corps,
the Medical Reserve Corps on the county side. Yeah.
I receive a PCR test monthly for surveillance. My January 13th PCR test was positive. My husband also tested the following day. We never experienced symptoms. I donated convalescent plasma on January 27th. The COVID antibody test on the plasma was negative. Why? Will I ever develop antibodies?
Yeah, so with this particular question, I think it's important for individuals to know that it may take up to 3 to 4 weeks for antibodies to develop after COVID-19 infection. So I'm not exactly sure if the timing of this particular case, if they tested too soon for the antibodies. But typically, most of the literature says it takes about 3 to 4 weeks for antibody development to occur. And again, keep in mind also that for the most part, the literature also says that from natural infection, we may have immunity for a few months at most, but then they will start declining over time. So,
and the other thing is that there does seem to be a correlation between, and this is not hard science yet, but so for an individual, depending on how much virus you get exposed to when you become infected, if it's a little bit, you're more likely to have an asymptomatic infection. You'll test positive because remember the PCR test is extremely sensitive, right? It'll pick up very small amounts of virus, which is in some scenarios been a bit of a problem, but it's very, very sensitive. And so you'll test positive, you have no symptoms. And if you have a really mild illness, you may not produce a whole lot of antibodies that may not last very long.
Right.
Now, if you get a lot more virus when you're first exposed, you're more likely to get sicker and then have more of an antibody production afterwards. That's what I would predict. I don't know that it's been proven yet, but that would make sense.
A friend had post-vaccine symptoms that lasted 3 days: fever, pain, aches, fatigue. She attributed it to the vaccine, but to me it sounds like the virus. Can you tell without a test what's the difference between the symptom and a side effect? Really not a side effect.
I think you can get any of the COVID symptoms you can get. They shouldn't get them terribly severe with the vaccine, with the exception I've not heard of anybody losing their sense of taste or smell with the vaccine.
Right.
That seems to be clearly unique to the virus itself.
As well as the GI side effects.
And the GI side effects. Well, no, I did have one case of somebody who, and it may have just been, true and unrelated, but they got vaccinated and then 2 days later they had diarrhea. But it could be true and unrelated.
If a person is testing positive multiple times, how many times is the CDC counting that positive test result? Could these be inflating our numbers? No.
Well, the test gets counted by the person, not by the test. So if one person tests positive multiple times, it's still only counted as one person.
Okay, I just passed the parking lot of a closed fast food restaurant that has opened a test site. I've heard so many stories of free tests not being free. Shouldn't testing sites have to publicly have signage to state if they will charge you before getting into a drive-through lane? If you are asked for proof of insurance, does that mean your insurance company will be charged? More than likely it will be.
Yeah, they are allowed to charge an administration fee.
Yes.
It's minimal. It's like $18. But they're allowed to charge that to your insurance company, not to you, the person showing up.
Thank you for joining us with COVID-19 Talks with Local Health Authorities, sponsored by Rotary Club of Houston. We'll be right back.
Hi, I'm Simone Biles. Mask up like a champ to protect yourself and everyone else.
As we reopen our city, it's important that we do it safely. Continue to wear your mask in public.
Wear it like a champ.
Mask up, Houston.
I work out every day. COVID won't kill me.
I'm 24. COVID won't kill me.
I have antibodies. COVID won't kill me.
It's been a long week. COVID won't kill me.
I'm 25. COVID won't kill me.
I'm partying outside. COVID won't kill me.
I don't need to wear a mask around my friends. COVID won't kill me.
I'm 23. COVID won't kill me.
If I haven't gotten it yet, COVID won't kill me.
I'm young. COVID won't kill me.
Famous last words. Don't let them be yours. Socially distance. Mask up, America.
Houston, we have a problem, more like a pandemic. Third ward to fifth ward, we can't afford to lose this. A-Leaf Acres Home, Sugarland, and Sunnyside. We know it's hard to stay inside. You are not alone. And when you do leave, mask up. If not for you, then for other Houstonians. That keeping your distance is still the safe thing to do. Remember, there are people on the front lines. Show them we still have their best interest in mind. Please wash your hands and get tested. This is Houston, and we must protect the H.
Of questions about the coronavirus?
I'm here to share some simple steps you can take to help protect yourself and others.
Avoid touching your eyes, nose, and mouth. Wash your hands often with soap and water for 20+ seconds.
Cover your cough or sneeze with a tissue.
Clean and disinfect surfaces and objects. Wash hands after touching commonly used items.
Together, we can help slow the spread.
The fight goes on, because just when you think this opponent seems to be pinned down, it comes back to life. So keep your guard up, because if your mask comes off, the fight is lost for all.
Wash your hands. Avoid sick people and touching your face. There are everyday actions to help prevent the spread of respiratory diseases. Visit cdc.gov/COVID-19. Brought to you by the National Association of Broadcasters and this station.
Downtown is an art lover's dream with more than 65 pieces of public art.
Houston, let's be better. And the only way we can do that is together. Let's be consistent about keeping a safe distance. Sanitize to save lives. Let's be beyond better about getting tested. This pandemic can only end if we are in this together.
Welcome back with COVID-19 Talk with local health authorities. Where's information about those who are vaccinated consolidated? Is it at the state or the federal level? If I receive one shot in Harris County and a second shot in Fort Bend, am I supposed to notify anyone? Will there ultimately be a vaccinated list site? Well, actually, all vaccines that are administered are going into the state's MTRAC system. But we're discouraging people from going from county to county or provider to provider for first and second dose.
We talked about all the problems that creates. Please don't do that.
According to Johns Hopkins, Texas is up on both positive cases and testing. What is the current state for the city and county?
Well, on the county side, our positivity rate is coming down. It's still elevated. It's still, it's right now around 17.4%. We're still seeing upwards of well over 2,000 cases per day. So still a good amount of community spread in the county.
Same with the city.
What do we know about asymptomatic transmission after being vaccinated?
Well, we don't. That's one of the problems. So there's a little bit of good news. So with the AstraZeneca, they actually did look at this, and it looks like, now that's not been approved in the United States yet, but with that one, they were able to, they watched for that. And it looks like if you're vaccinated, it reduces your asymptomatic spread by about 2/3. Which means it's not zero. It's still, right? But with the others, with Moderna and Pfizer and Johnson & Johnson, we don't know yet if those folks can become infected but just have no symptoms and be able to spread. We don't know that yet.
We don't know that.
Okay. Realistically, how will mask wearing be enforced in buses, taxis, etc.? It's really up to the people that, you know, that are driving the bus or the institution that's responsible for that mode of transportation. If I'm reading the Harris County dashboard correctly, the weekly total by percentage shows ages 30 to 39 have the highest cases at 16.3. Since 80% of all those cases are those under 60 years of age, should we shift our priorities and vaccinate younger people now?
So this is a great question because right now we're trying to, our priority is to stop the dying. Right? So by stop the dying, by getting those who are most at risk of dying to get vaccinated. And this actually, from my work with the police department, we've got a phrase, stop the killing, stop the dying. It's a different sort of thing, right? So right now we're trying to prevent those from dying, and then when you get that, then you shift to those who are the ones that are spreading, right? So that's the prioritization there.
When one shot J&J is here, do you recommend getting that? And when there is ample availability, getting one of the others as a booster to increase efficacy?
Not necessarily. I think that as we have more and more vaccines that will come available on the market, that'll get authorized, I think individuals should take advantage of getting whatever type of vaccine that they have access to offer them immunity and protection.
If I already have had COVID, am I more or less susceptible to the new variants?
Probably less.
Okay.
Right? Because there's probably going to be some cross protection, but I wouldn't, there have already been cases, clearly there have been cases of people who are infected with the old one who've been infected with the new one. So
some say the variant will become dominant and we will end up with just those strains. Your comments?
Yeah, and we've seen that happen in communities across the country. I mean, that predominant strain took over in the UK. And so again, I think it's really important for our community to understand those prevention measures, that we don't stop, although we're seeing some declines in some of the data, we really shouldn't take our foot off the gas with those prevention measures.
This is the concept of natural selection. Those things that are better suited to survive are going to.
Yep.
The long-range goal would be to get a vaccine that would be good against all coronaviruses. This is quoting Dr. Fauci. Please comment.
He's right.
Yeah.
Are Pfizer and Moderna only working on dealing with boosters of South African variant? The UK variant seems to respond to the current vaccine.
I think they're right now, yeah.
Yeah. Yeah, so the vaccines are, I think that was a question about the vaccines.
I think what the new ones they're developing.
Developing, yes.
Okay, the UK is a bit ahead of us with the variant, and their response is stricter lockdowns, especially the lockdown of both primary and high school. Is there a takeaway for the U.S.?
Yeah, we need to stop the variant. We need to stop the version of the virus that's spreading across the United States now before we get into that situation.
Both Moderna and Pfizer are conducting age de-escalation testing to determine the viability of use from age 12. How long would it take? Will kids be able to get vaccinated in preparation for the next school year?
Yeah, I think that's the goal, is to try to see if those studies are underway right now. I mean, those clinical trials are happening right now for the adolescent age range, and then for the lower age range down to I think the 5 and above age range, that's going to happen later in the year, late 2021. But the idea is to have these clinical trials underway so that for the fall, they'll be able to have those vaccines available for adolescent age range.
There are several imported alcohol-based hand sanitizers that are supposed to be unsafe. Are those made in the U.S. regulated and completely safe? I feel like I'm bathing in this stuff every day.
So not necessarily.
Yeah.
The thing is that, you know, the label often says alcohol. Well, there are different kinds of alcohol. So ethanol, ethyl alcohol, ethanol, and isopropyl alcohol are okay for humans, but methanol or 2-propyl alcohol are the other ones that are commonly used. Those are toxic to humans. They are alcohols, and so you got to be a little bit careful. And are there unscrupulous ones manufactured in the United States? I think that I think we've seen that already. Yeah.
And I think just to add on that, FDA recently has an alert out on certain brands because they have noted that they have the wood alcohol component in it, which is toxic once it's absorbed. So there is an FDA alert out on certain hand sanitizers that are coming out of certain countries.
So we probably need to really put that out. The Lancet published an article about another strong phase 3 trial called Sputnik 5. Does that look like a prospect anytime soon? That was made in Russia, wasn't it?
Yeah, it's I'm not familiar with that. I'm not familiar with that one either.
Okay, post-vaccines, are there any preventive over-the-counter medications besides vitamin C and zinc you could recommend?
Post-vaccine?
Yeah, this is the vitamin question.
Yeah, so again, the best source of vitamins obviously is going to be through your diet. And then obviously vitamin D has been one vitamin that's been talked about a lot. Sunlight is a great way to get that exposure. Some people have had, again, the myalgias and the sore arms, so over-the-counter medications for that would be like the Tylenols and the acetaminophen type of things.
Are there any resources for those experiencing long-term effects?
Long-term effects of COVID?
COVID, yeah.
Yeah. I think the long-term situation with COVID remains a bit of a mystery. So
yeah, but there are certain institutions in town that have specific clinics for long haulers, and so those are good resources for the community.
Any cautions about Super Bowl weekend?
Yeah.
Stay home.
It's the same way for everything else.
Limit those gatherings. Yeah, just do it virtually, your celebrations.
I tell everybody, you just need to be a Buffalo Bills fan and you won't care.
I wonder why you're a Bills fan. So what's your advice?
Yeah, I mean, I would, again, limit those gatherings. We really want people to really understand that just the precautions and the advice that we gave for the holidays, it really translates to the same thing that we're talking about. If you're gonna gather in with your family, your nuclear family. Outdoors is always better than indoors.
And if you look at our current data, I got to believe that this last wave, it began right around Halloween. It got worse at Thanksgiving, and then the Christmas and other holidays around that time of year, and then New Year's. And now things are starting to get a little bit better. The numbers are starting to. I think it was all the holiday gathering stuff. So the Super Bowl is just another. It's just another one.
The cumulative effect of all those holidays, and people are really not.
Yeah.
I have no other reasons why we had that big wave.
We really want to discourage people from.
Look, it's clearly not the weather. Yeah. It's not the weather.
Thank you for joining us with COVID-19 Talk with Dr. Sherri Onyiego, representing Harris County, Dr. David Persse, representing the city of Houston. I want to thank you to past President Kathy Finninger of the Rotary Club of Houston. I'm Stephen Williams, Director of the Houston Health Department.